more on this new craze and what exactly this procedure is all about. We're joined by Dr. Anna Kelly. She's the Vice President of the American Academy of Medical Acupuncture. Thanks for joining us here on CNN today. So I guess I wasn't the only one. You know, last night I was watching the swimming competition and I started Googling what in the world are those red welts on Michael Phelps's back. It was obviously something that a lot of people were searching. So what exactly is cupping and why are athletes turning to it?
Cupping is a form of therapy that involves placing cups under negative pressure to strategic points on the body, and using two methods. The method I use in my practice is a flame method, where we use it's called fire cupping, and we use a flame to vacuum the inside of the cup, and it pulls the tissue into the cup and creates these marks, suction marks, and it's a way to improve pain and improve function. So it's a wonderful way to take care of ourselves when the athletes are putting so much out there.
So how does this help, how is it believed to help athletes perform better and help get rid of their pain?
Yes, that's a good question. It's an ancient technique, but it is rooted in the scientific method. It actually increases the blood flow to strategic areas and washes out metabolites, anaerobic metabolites that may have built up. It increases blood flow to specific muscles and can improve function that way. Chinese medicine is based in mystery, but we are using it more and more in modern medicine to fill in the gaps where modern medicine leaves off.
Yes.
So it reduces. I think the athletes are using it for pain management primarily.
But what other ailments does it treat? Because I do have a family member who used to do this cupping therapy many years ago for something completely different than, you know, performance in a sport.
Yes. It's used to treat pain. I commonly use it in my practice in Atlanta to treat fevers and colds. It's very good for expelling the wind, if you say. The way they look at colds and flus in Chinese medicine is an invasion of wind, cold, or wind heat. And applying cups strategically to the upper back, some of these control points for the lung, can improve the function and help the immune system perform better. So it can be used for that. It's also used for certain cases of palsy and weakness. It's used for many things.
Does it hurt?
It does not hurt. I've had it many times. It's safe and effective. There is a risk with the fire cups of burns. There can be a singe phenomenon that occurs, so we must be careful. There is a vacuum cup that is used without the fire method. This is a plastic suction cup, which some practitioners are using now. The cup marks don't hurt. They typically are painless and can last anywhere from 2 to 7 days, depending on how much stagnation is in the area. So actually, I saw some of the athletes with deeply purple marks, and I thought to myself, they need more cupping. The more cupping you do, the less the marks will be prominent.
Ah, I see, I see. And lastly, I mean, have you had a response, you know, to potential patients or people calling you interested in this cupping therapy? Because obviously you have athletes with these marks on their backs, and people around the world are seeing it and saying, what is this? And then you Google search it and it says it's cupping therapy. So are you expecting it to become a popular therapy for you?
Well, I don't know. It's so interesting that you asked that. A couple of celebrities had it 10 or 15 years ago and showed up in some of the tabloid magazines with cup marks on their back, with a backless gown for the Oscars, and it suddenly became a little bit more popular. But we've been using it in our practice in Atlanta for almost 20 years, and it's, you know, things come and go,
right.
And we've been steadily using it for a number of years, and it's been used all over the world.
Right.
You know, it's interesting. I have some patients that use it. They'll tell me their grandmother used it. On them when they were young. So it's a little bit of a folk remedy, but it's often used in conjunction with an acupuncture practice.
Well, we are out of time. Dr. Anna Kelly, thank you for that, and thank you for watching. I'm Amaryl Walker.